the reproductive signals originate in the brain. So just like everybody was.
Wow, that's the weirdest thing. That is mind blowing. Because when we were in school and we had that film strip lecture, it did not originate in the brain. It was the little picture of like the thing that looked like an ox. There was no brain. There was no brain involved.
That's not the talk I got.
We got a different
from my
talk.
Parents.
We got a different talk.
Yeah, it wasn't. The brain wasn't the problem, as I recall.
Yeah.
But I'm not a medical doctor.
Yeah.
Well, that's why it's so interesting that we talked about before that the metabolism originates in the brain also. And
I know. When you ever told me that the first time we got together and you said that metabolism in the brain, I'm like, I think we're lower down.
This is Fat Science, a podcast dedicated to the science of why we get fat. No diets, no agendas, just science that makes you feel better. This podcast is for informational purposes only and is not intended to replace professional medical advice.
I'm Dr. Emily Cooper. I've been treating patients with metabolic issues for over 25 years. I'm on a mission to raise awareness about metabolic dysfunction and why diets don't work.
Hi, I'm Andrea Taylor. I've been fat, very fat, chubby, morbidly obese, and done almost every diet ever invented. They all worked until they didn't. I've known Dr. Cooper forever, but when I became her patient and we learned metabolism was the real problem, wow, everything changed, and I've never been healthier.
And I'm Mark Wright. It's time for Fat Science.
Wait, does this podcast make me look fat?
Welcome to Fat Science. I'm Mark Wright, along with my friends Andrea Taylor and Dr. Emily Cooper. It's great to see you two.
It's great to be back.
Hello.
So on the show this week, metabolism and fertility. And Dr. Cooper, I'm guessing that a lot of people don't realize that there is actually a connection between fertility and metabolism. So let's start at the most basic level of this equation. Why is there a link between metabolism and fertility?
Well, metabolism, as we discussed in prior episodes, is the body's way of generating energy for different tasks in the body. And one of the most energy demanding tasks is our reproductive function. So for women, that means the whole ovulation cycle and doing that every month and stimulating estrogen production and ovulation. And for men, it's the testosterone, sperm cycle. And those functions really demand more energy for the body to do those things. And so that then if we see some glitches in that process, we want to find out, is there something wrong in the metabolic pathway that is prohibiting the energy to get to the reproductive system?
Wow. So just from an evolutionary standpoint, we're talking about expenditure of energy. And if the body is perceiving a famine or a lack of food or something like that, it says, hey, maybe we shouldn't reproduce now. Is that sort of the origins of all this?
That is, and it goes beyond just the energy requirement of it, because there is an energy requirement to keep your, hormonal systems, your reproductive hormones activated. But there's also, just if you think about it, a survival mechanism. If there's a perception of famine, of course, a woman shouldn't really carry a child because it can really create more malnourishment for that woman. It could put the woman's health at risk if she is truly malnourished and then has to go through a pregnancy and support an offspring and the development of that. That could put her health at more risk and create more malnourishment for her personally. But then on top of that, why it would affect men as well and women is that bringing a child into a world of famine is not really thought to be very strategic, from an evolutionary standpoint. So, because the survival of the offspring would be at risk as well if we're really bringing an offspring into a world of famine. So all of this perception of food availability, body weight status, if there are glitches metabolically that are throwing those perceptions off, or if there's actual starvation, that will definitely feed down to our reproductive system and will inhibit those processes that allow us to become pregnant.
What's the most common way that the metabolic system can affect fertility?
Well, what we see, um, it's not what people would think. I have a feeling. What I see, just as a clinician, and my patient population might be totally different than another clinician, so they may see something different. But in my own patient population, what I see as the most common cause is what we call high famine signals or low security signals, which often is from chronic dieting, um, or underfueled exercise, just simply from a mismatch in the amount of nutrition coming in and the activity of the person. So you see a lot of this in people that have been struggling with excess body weight, that have been on diet after diet. You see a lot of it in athletes that are like inappropriately fueling the workouts. So that's a really common group. That's not the only group, but I see that at a real high percentage. But there are other causes as well.
Hmm.
So, too much exercise for a man or a woman could make it so that you have problems conceiving a baby.
Well, yeah. And the studies that they've done have shown it's not really the exercise causing the problem, it's really the lack of nutrition to support that exercise. Yes.
Oh.
And sleep also could play a role in athletes because,
What about stress?
well, that can play a role in everyone. Stress, yes, stress can affect us, both directly and indirectly. It can affect our hormone balances, and it can disrupt our sleep, which then further affects
Mm.
our metabolism and our reproductive hormones. Especially men, testosterone levels really suffer with problems with sleep and stress, because testosterone is a hormone that helps men adapt to stress. But if too much stress is applied, it kind of collapses under the pressure. And so, with that collapse, you can have reduction in sperm counts and sperm motility, and that can definitely affect male fertility levels.
Oh, wow.
So, Dr. Cooper, when I first started coming to you, one of the things that you had me do, I was injecting testosterone cypionate to boost my levels. How does that? So, what's happening in males when stress? Because I was under high levels of stress, my metabolism was whacked out. What's exactly happening in terms of the testosterone in the body, and why is it so important to restore the body's own manufacturing of that process?
Yeah, and it's testosterone is in men is affected by so many things. So one of them being, again, not fueling on a regular basis. When I first met you, remember you were not organized with that nutrition
Hmm.
frequency and composition of your food, and getting that dialed in. But if there's a lack of nutrition security signals, it actually prevents your brain from sending the signals to the testicles to produce the testosterone. So your brain just says, "Oh no, I am not authorizing this testosterone production," because
Stopped at the border.
exactly. Yeah, and so it's not really a testicle problem, and if
Huh.
people don't realize testicles are where the testosterone comes from, it's manufactured
Right.
by the testicles, but, it's the brain just not authorizing the production, and so at the direction of the brain, it shuts down because the brain is perceiving, "Wait, we don't have consistent food supply," and then, "Oh, we're not even getting appropriate sleep, we're kinda overstressed already. If we make testosterone now, our host is going to have more energy and try to go out and do more things and waste all this energy that we don't have available. So we're just going to cut them off." So,
Isn't it crazy how complicated this whole loop is? And the brain is so sophisticated at not getting tricked by nature. It's like it can adapt to almost anything that happens, but it's
it's
just
so true.
I'm just blown away at how complicated this whole loop
Yeah,
is.
on one hand, it's real complicated because there's a lot of reactions going on. But on the other hand, it's so simple because it's very logical. It's if there's a perception that your energy intake is not sufficient, you're overstressed, Well, it's logical that if your brain could, it would slow you down, make you rest, make you tired so that you would realize, wait, I'm pushing myself too hard. And so the ways it does that is turning the dial down, actually, not only on the testosterone, but on your thyroid levels, on any kind of hormones that allow you to utilize more energy. And when you can utilize more energy, you actually can do more things. So, one of the big complaints we get with men whose testosterone's been affected is fatigue, being tired. And then when they do workouts, it's more difficult to build muscle strength because that requires a lot of energy and a lot of testosterone. So, but that's one way that the testosterone levels drop is just that sense of insecurity. But there are other ways. For example, if insulin levels are too high, when the insulin levels are too high, they kind of interfere with signals that are coming from the brain to the testicles. So now, in this case, the brain is sending the proper signals, but the testicles are not responding. And that can happen with a variety of metabolic imbalances, such as elevated insulin levels, which can get in the way of the signal and interfere, or elevated ghrelin, which is a famine signal circulating. And so these things can really interfere with those signals and prevent the testicles from producing the testosterone levels that you should have in order to generate sperm, healthy sperm, and be in good reproductive health.
So, what causes the infertility within the metabolic loop? Like, how does the metabolic loop affect the infertility?
In women, infertility can come from the brain signals. Similar to men, both women and men, the reproductive signals originate in the brain. So just like everybody was.
Wow, that's the weirdest thing. That is mind blowing. Because when
We
we were in school and we had that
oh no.
film strip lecture, it did not originate in the brain. It was the little picture of like the thing that looked like an ox. There was no brain. There was no brain involved.
That's not the talk I got
We got a
from
different
my
talk.
parents.
We got a different talk.
Yeah, it wasn't the brain wasn't the problem as I recall.
Yeah. Yeah.
But
That was a
I'm not a
different
medical
talk.
doctor.
Yeah.
Well, that's why it's so interesting that we talked about before that the metabolism originates in the brain also. And
I know. As soon as when you ever told me that the first time we got together and you said that metabolism in the brain, I'm like, I think we're lower down, lower down.
but it's
Not really
true.
there,
The
but
brain is
Yeah.
the CEO, as you always said, Andrea.
Yeah.
The
I
brain
know.
is
The
the
brain is the
CEO of
CEO.
the metabolism, but it's also the CEO of the reproductive system because the metabolism is so linked into reproductive health. And so all the
It's
signals that are
unbelievable.
coming from our body to our brain about our metabolic system are processed by our brain in an area called the hypothalamus, which is like a very high
Oh,
center of
right.
our brain.
That
And
that little
yes,
thing.
and that's the very in close connection with where the reproductive original hormone signals stem from. And so there's a lot of interplay and feedback between what our metabolic system is saying and what our reproductive hormones should be doing. So that so ovulation can become impaired if the brain again decides, wait, the conditions are not healthy for reproducing. Either because the offspring will be entering a world where there's an insecure food situation, or the mother will be exposed to malnourishment if we allow this based on all the information that we have. And so that's when it's called anovulation, failure to ovulate. Cycles that don't produce ovulation in women, and so that originates at the hypothalamus, and then those signals fail to stimulate the next gland down, which is called the pituitary gland. Not to get too scientific, but the pituitary gland. And the pituitary gland then is not permitted to send out stimulating hormones that would tell either the male testicles or the female ovaries to go ahead with reproductive function. So that's
Hmm.
one way that ovulation is inhibited, but there are some other ways too.
Well, let's talk about those other ways, Dr. Cooper, because I'd love to know just from the typical patient who is suffering from infertility that comes to your clinic, have most of them just stopped ovulating for various reasons?
Yes, most of them are not ovulating or not ovulating on a regular basis. But then every once in a while, when we do their workup, we'll say, "Well, you look like you are ovulating. It looks like your reproductive system is in good shape. We need to turn the spotlight on your partner because
Hmm.
most likely that's where the issue is going to be seen. And at that point, their partner hasn't even ever been checked. And so we can actually see the health of the reproductive system by just looking at the lab work normally. There are exceptions because there can be anatomical problems. So you can have great lab work and it looks like everything should be working, but there could be an anatomical issue in males or females that are preventing the egg from traveling down or implantation or something going on, infection or fallopian tube scarring and things like that in women. And so you can be misled by very healthy looking lab work, but usually you can tell. And so either we find that the ovulation is impaired because of those that fear of famine signaling in the body, or because of high levels of insulin, which is common in a condition called PCOS, which you may have heard of. So there can be different causes.
I've met a bunch of people who've had PCOS, and I know that you said that it is reversible. And I also know that from them, they all thought that it was something that they were going to have for their whole entire lives. Can you talk about what you can do to maybe reverse the condition?
And also, what help me out, Dr. Cooper? What does PCOS stand for again?
Oh, yeah.
PCOS stands for polycystic ovarian syndrome. And one of the biggest misconceptions about it is that number one, well, there's a couple of misconceptions. One, it's caused by high body weight. And number two, that it's just irreversible and that once you have it, you have to live with it and it will always block your fertility. So I think those are real misconceptions because it can occur at any weight in a person. It's not so much weight dependent, it's dependent on certain chemistry in the body. So the main causes of PCOS are actually elevated levels of insulin or elevated levels of a couple of famine signals in the body. One is from the stomach called ghrelin. Again, you'll hear about ghrelin a lot. And the
Mhm.
other is from the hypothalamus, which is in the brain. And that one is called agouti related peptide, AGRP. And so if any of those are elevated, you'll often see manifestation as this PCOS picture. And there are certain diagnostic criteria for it.
So, what's actually happening with PCOS that affects fertility?
Well, what really is going on is the brain is actually trying to signal the ovaries to produce estrogen and to ovulate, basically, to go through the ovulation cycle. But then what's happening is circulating levels of insulin are very high and they desensitize the ovaries to those brain signals. And so now the brain signals are having trouble pushing their signals through to the ovaries and the ovaries are not responding. And so you'll see in the blood work very high, abnormally high levels of the brain signals, but you'll see low levels of the response signals from the ovaries. And so that's one way to see it. There's other diagnostic criteria because it's impairing ovulation. Each time the follicle, which is what we ovulate from, is developing and doesn't succeed at releasing and ovulating, it can form a tiny little cyst in the ovaries. And so that's what gives it the name polycystic, which means multiple cysts. But we're talking about dozens of cysts that are very tiny, where that's another misconception. People think it's like a large cyst that they have that meets the criteria. But no, it's not these large cysts that can be painful. These are tiny, tiny little cysts that you can only see on ultrasound. Um, and they form as a result of failed ovulation cycles. And so you'd see that. And the other real common characteristic of it in women is elevated testosterone levels and another androgen. Androgens are male hormones. And, women and men both have male hormones, but women's levels are much lower. But in PCOS, the testosterone and another one called DHEA sulfate, those both elevate into ranges above the normal female range. And by doing that, you'll see physical symptoms too of abnormal hair growth. It's called hirsutism. So you'll see facial hair or abdominal hair for women. That little line above the belly button of hair that you often see in men, you'll see in women. Acne is a very common manifestation of elevated testosterone in women, and also hair loss in the temple region of the scalp. So those would be clues about the elevation of the androgen levels in the blood. So all of this, can manifest in PCOS. And because of that, you don't see the exact same picture as you do when it's all brought on by a famine, by like really heavy famine signaling. Um, but you do see the anovulation anyway, the failure to ovulate.
I'm guessing there are a bunch of little kids running around the Seattle area because of you treating parents with fertility issues. Give me some of the good stuff, Dr. Cooper. I'm guessing that you've helped a lot of people overcome infertility.
We have. It's so much fun. And we've had some of our patients have had like three children, after first struggling. And then we found the underlying cause, addressed that. And they went through healthy pregnancies and then became pregnant again and again. So we have many, many patients who have had wonderful families, just because of looking further into their metabolic system. Sometimes we do team up with reproductive uh, specialists who may need to assist in some way, or they may send patients to us to look for this underlying cause because the fertility treatments aren't really working. But often we don't really need to do anything too dramatic, just really kind of, I'll tell you, the most valuable thing is really the nutrition. It's just getting the nutrition dialed in so that we can really punch down any kind of famine signals and strengthen our security signals and give the body a chance to perceive, okay, we're not starving anymore. How do we feel about it now? And often we will see a perking up of the brain signals that says, I'm starting to think this is a safe environment now. And so nutrition is just huge, but you also need to find other underlying causes of what's driving the metabolism dysfunction in the first place. And so a lot of people with underlying metabolic dysfunction do have elevated body weight too. And so that's also a potential symptom. And so, or they may have prediabetes or, as I said, insulin resistance with a lot of other, comorbidities such as high triglyceride levels, hypertension. So you want to look at that whole picture and apply whatever treatment we can to out of our toolbox to help restore the healthiest metabolic function. And as a result of that, we see the reproductive system really become healthy as well.
I've heard so many stories, Dr. Cooper, of people who could not conceive and tried for years and years and years and years and then gave up and adopted a child and then got pregnant. And I'm just thinking there must be a link between the idea of stress on the body and the brain. And have you heard those stories as well? Is that completely anecdotal, or do you think there are some studies that support that?
Well, yeah, I've even seen it clinically. I'm not sure about, the degree that stress has on our reproductive system, but if you think about it, I mean, stress is known to affect our metabolic system quite a bit. Because if you are a person that suffers from insulin resistance, for example, stress exacerbates insulin resistance. So, and also if we're pushing ourselves and stressed, then you end up in that mode where your body doesn't want to spend the energy on this reproductive health and aspect. And so I think it definitely is linked. And one more thing about PCOS, women's reproductive cycles and PCOS have a characteristic pattern of being very long in between each cycle. So instead of the normal 28-day cycle, they can go quite a long time. They can skip cycles. They can um, have menstruation every 3 months, every 6 months. So that's very typical in PCOS, although it's not always an indicator of PCOS. Where in people who have an ovulation due to the famine signals, often those periods can be very heavy for women. They can be very irregular, but can be actually really heavy. So if there's a lot of excess bleeding associated with the menstrual cycle, that might be an indication of anovulatory cycles from famine signal imbalances.
What are some of the other ways that men's sperm counts could be lowered?
Well, we talked a little bit about the nutrition aspect, which I still think is the primary one. Just insufficient fueling, especially with men, a lot of times ramping up their exercise and not their fuel, or going on fasting or low carb diets. That's guaranteed to really jeopardize their reproductive function. But in addition to that, unfortunately, sperm counts are reducing, like just globally, as far as I know. Especially, I know for sure in our country, the sperm counts are definitely reducing. And men today, with like what's considered a normal sperm count today, would never have been accepted as sperm donors like 20 years ago, even because they would have been considered to have low sperm counts. So our normal ranges have shifted down, down, down over the past several decades. And a lot of that is thought to be related to our environment, our chemical environment, and endocrine disruptors that are in prevalent in our chemical environment and very abundant. And those were things again like the plastic derived elements like BPA, BPS, phthalates, which are so common in food packaging, in the wrappers, for takeout food, in fragrance, air fresheners, off gassing of carpets and upholstery and new cars, the new car smell. So the exposure to those things on a daily basis is really affecting men and their sperm counts. And this is at least what is hypothesized and studied quite a bit. And there have been several studies looking at this, and it is a potential concern. So, in addition to the possibility of underlying metabolic disruption, exposure to these endocrine chemicals, endocrine disruptors, that can actually affect the sperm counts, and it seems to be just pulling them down throughout our country for the past decades.
So, Dr. Cooper, what are some practical ways that guys can get those endocrine disruptors out of their daily lives? Like, what are some simple ways?
Well, the good thing is they have done studies that have shown if you do limit your exposure within 4 months, your blood levels and body levels, tissue levels do reduce. So it is possible to reduce it. The first thing is we usually ask a lot of questions if we see things that we suspect there could be endocrine disruption as, one of the factors. So we'll ask people a lot about their environment, where they spend time at home, at work, their car, or is there a remodeling project going on? You know, Having a concept of trying to minimize your exposure is really good. So if, for example, you do need to do some remodeling, Well, you kind of do want to make sure that you're choosing products that don't off gas as much. And there are options for that. For adhesives, certain types of synthetic carpeting is not good, while I know it's more expensive, but wool wool carpeting is better. Um,
Mhm.
Andrea's smiling because
Yeah.
in
Oh,
she
I
knows
know.
this area just from a product
It's
standpoint. But
yeah.
yeah, and cars, maybe if you're thinking of starting a family, it's not the best time to buy a new car. Wait and just stick with your old car because it takes a good year for your car to off gas. And in the meantime, if you don't live in a warm climate where you can roll the windows down, you're being exposed to those chemicals and
Mm.
it can be affecting you. So, and if you're trying to remodel your house to get ready for your newborn or something, that's also important to focus on not using materials in their room, their planned room that, contain a lot of endocrine disruptors. But I think what practical things would be is just looking around at your environment. Just try not to use fragrance. That's a very common source of endocrine disruptors. And try to maybe don't drink out of those crinkly plastic water bottles. Don't eat things out of cans if possible, or drink, especially anything corrosive like tomatoes or sodas and things like that, because the cans are lined with BPA or BPS. And also, don't trust the marketing of some of these products because they'll say BPA free, but it actually has BPS, which is also not good. So
Mm.
it's hard. You can't be perfect in this area at all. But you could look around and say, okay, am I like really getting exposed here? Do I need a HEPA filter, or do I need to open some windows, get more fresh air in my environment, or wear some, air protection if I'm around solvents or things like that. So it varies from person
Mm.
to person where their exposures come from. And so, I would try to keep it simple because it is really something that you can go down a rabbit hole trying to prevent your exposures.
Yeah, yeah. And also we should say, smoking,
Oh, thank you. Yeah.
alcohol, recreational drugs. So that's the kind of stuff that it can also affect guys too, right?
Yes, absolutely. Some things that are easy to address would be consumption of, tobacco, smoking, alcohol consumption. Certain recreational drugs also affect our fertility. And so
Hmm.
those things, are something to definitely address as a primary.
So, what's the big takeaway with metabolism and fertility? What are the top 2 or 3 things?
I think infertility is your body's way of saying something's not right here. And so let's find out, what is it? And it may be that just looking at your lifestyle, you can identify some things right away that may be, I started this new exercise program. I have been on these diets for who knows how long. And I've been, you know, in this mode of cutting out my carbs, or I've been fasting, or I'm jumping out of bed in the morning, going and doing a workout without fueling first. Are there any obvious things like that? And can you just change the behaviors around those areas and see if that does make an impact? But if there's nothing really obvious and nothing that seems to respond to your attempts to change and become healthier in your lifestyle, then definitely seek out evaluation for what the underlying cause is. Not just seek out fertility treatments, but what could be the actual cause of this. And I think getting to the root cause, that's what leads to families that not just one child, but another child and another. And they become easier and easier once you've identified the underlying cause of the infertility.
Well, this has been so much fun. Just tons of great information about fertility and metabolism. Dr. Emily Cooper, Andrea Taylor, so great to have you here. Thanks for being with us for another edition of Fat Science.
No diets, no agendas, just science that makes you feel better.
See you next week. I'm Mark Wright. Thanks for listening to Fat Science with Dr. Emily Cooper, a Work P2P production. New episodes drop every Monday. If you've enjoyed the conversation, subscribe, rate, and review this podcast. This production is for informational purposes only and is not intended to replace professional medical advice. Join us next week for another episode dedicated to the science of why we get fat. No diets, no agendas, just science that makes you feel better.